Sorry, Wendy, I missed your part. I didn't turn on the volume just now. So yeah, you were saying?
Oh, sorry. No, I was just introducing what you'll be speaking about today. So, Doctor, you will be speaking on sleep as well as the night owl and the Belun ring.
Okay. Again, thank you. I think all of you will do this every day, right? Sleep, right? And I think maybe a few members of our team sleep more than some. Who sleeps the longest hour? Can you put up your hand? No one. Okay. I just did my monitoring. I'm just averaging about 6 hours plus for the last week, which is not enough. All right. So definitely need to put in more effort. So as I'm trying to share this information, I'm trying to walk the talk as well. First thing first is that I'm wearing my aligner today. Can you see? Yeah. So my first set of my don't know how many series. Hopefully this time round will persist on to finish the whole series to expand my upper and lower jaw so that I can breathe, because it's all part and parcel of the whole treatment and preparing myself. Okay, so let me start with this. Okay, just a moment. Let me just choose that one properly first. Okay. All right, share. And click. Okay. So first question to ask, why is sleep so important? Can you all type in the chat group? Thanks. All right, today I want to make it such that it's not me just babbling on, because no point I just talk about it and I'm not sure whether you all know anything about this topic. So I'm going to make it as interactive as possible. All right, so I'll be asking questions, I'll be answering them, and at the same time I'm looking at all your answers as well, so that we can share what we know about this topic together. Okay. So why is it important? And repair of the body takes place in deep sleep. Okay. Charlene, this loser. Charlene say we can do more productive things during the day. Janelle say better concentration. Melissa say best body repair and rejuvenation. To perform our duty well, Martha and Ming, and then to Hazel and Ian says beauty. Hongmei says energy. Jaya say body rest and repair during sleep, and resting our body and replenish our energy. Okay, so we all understand that it's very important to repair the body, but how does sleep allow you to do so? All right. So my question to everyone now is that is there a specific number of hours that we need to sleep? Or is it the quality of the sleep? Aline says to consolidate memory. Very good. All right. So from your own understanding, how many hours of sleep is required? 7 to 8, good. 6 to 7, 8, 8, 7 to 8, 8, 8, 8. Okay. So I think this is a very common understanding number, but I think there's a 10, and I guess that one must be Ian. Then there's Joel, 7, and Melissa put in a good point. They say that quality of sleep, but at least 8 hours. So that's also a very good point. So full complete cycles, user is mentioning that 7.5, 3 cycles. Yeah, truth is that we go by cycles, right? It's almost 90 minutes per round when we sleep. Okay, and for those of you who have children, the first cycle is very important. This is when the growth hormone will be released. 75% of the growth hormone will be released when we go into deep sleep. And for all of us, the grown one, right, growth hormone is still important to help us maintain our body. So having a good deep component in the first cycle is also helpful for us. Okay, so now we can see that most of us, highlighted quite a few things, mainly mind body, right? Good. Then next point is, how big is the local problem, right? When we talk about sleep. So the thing is that right now I'm talking about sleep not as just a academic point, because I think to us we can find all these academic points and online. But what I want to share with you also is this, in a sense, is a commercial component, right? I'm looking at it as a component on why our clinic is doing sleep, all right? Because like I said, why even go into this area where nobody is doing it, and it's so difficult to do, right? When nobody is bothered. Okay, so how big is the local problem? Anyone? How big is the local problem? Meaning, how big is the population that is involved, right, with this problem in Singapore alone? All right, so Patrick highlighted that, it's 6 to 7 day loss per year per worker. All right. Then, okay, so Jaya highlighted that, 1 in 3, right, in the population have sleep apnea. Anyone else? Okay. Most people are not enough sleep. Very good. 6 out of 10, right? So 6 out of 10 is 60%. And I think the number is even more. Just all of us here, you take a poll, who have enough sleep here, right? Huge problem, but most in denial. Louisa mentioned, Jaya say most people waking up tired. And Patrick highlighted 3% of GDP is lost. So Martha, sleep quality versus number of hours. Right. So I think the key is that all of you understand that it's a huge problem, right? So how big is this? So we look at this article. You can see the screen of the CNA report. Nearly 6 in 10 Singaporeans aren't sleeping well. But they say it's because of COVID. But really, if you look at the study, right, Philips has done some studies before COVID and also after. And they highlighted very clearly that 51% at least think that they didn't have enough sleep, right? And it's a huge number, however way we look at it. All right. So I think the key point here is that 1 in 3 Singaporeans suffer from sleep apnea, right? This is a 2016 report or a newspaper article that is highlighting a research that's done in 2012 in Singapore involving almost 2,000 people. All right. So they highlight that 1 in 3 suffer from moderate to severe sleep, 1 in 10 severe. All right. and fatigue, intellectual impairment, headaches. They talk about 90% of these people were previously undiagnosed. So not only the problem is huge, right? Most people and most doctors are not picking up the problem and letting the patient know that they can actually deal with it. And for the Chinese and Malays, they have the highest number, but Chinese still is the highest of the ethnic group. And I think one of the reasons is that really we have small jaws if we don't have good oral habits. All right. And the build at the back of the throat is narrow. So it makes it easier to have this blockage, which then affects the whole breathing component. But I wanted to also share that it doesn't have to be totally sleep apnea. Sleep apnea is that you don't breathe at all for about 10 seconds. But it can start from just simply mouth breathing. So you sleep with the mouth open and go. Also, you can develop a slightly more blocked airway and you go, and that's snoring, right? And it become even more blocked, it will become wheezing sound like this. Right? And then lastly, you have your OSA where you totally stop breathing. So this problem is huge, and it's actually mentioned by the researcher, Dr. Tan, Adeline Tan, that you can literally go and see like, polyclinic or general practitioner, and they can do some screening before we escalate the problem to specialist level. All right. So literally, this thing called testing, can be done. Okay, I lost one. Just a moment. I will look out for 9 hour in. 9 hour. Yep. So we have currently 2 screening tools that we have in our clinic. All right. One of them is known as the night owl. It comes like a little tab that you can put onto the finger. And we also have the rechargeable version, which we're still testing it to see whether it's working or not. But we do have all this disposable, good for at least 10 nights of testing, right? So then it will give us a number. So this number is known as the apnea-hypopnea index, AHI for short. So 7 means in an hour, you have about 7 episodes of stop breathing, almost 10 seconds, right? And you have 15 and you have 22. So they classify it as 5, below 5 is mild, below 15 is moderate, right? Oh, sorry. Below 5 is normal, sorry. Between 5 to 15 is mild. Between 15 and 30 is moderate. This is moderate. And then anything above 30 is, right, is severe. All right. So this is just an indicator. It's not the most accurate one because this kind of testing is only taking certain parameters in which is like how much oxygen inside your blood, right? So it's a pulse oximeter, and also it's an actigraphy. That means when you move around, it detects movement. So the idea is that if you are in deep sleep, you don't move. When you're light sleep, you move. And it takes heart rate as well. So when you're calm, your heart is beating slowly. And when you fight for air, right, the heart rate goes up. So the other technology that we just got is called Belun. All right. So it's another device which is from Hong Kong. And I tried it out and I find that it's quite comfortable to sleep with it. All right. And we're still not getting any result because we have not set it up correctly. We just got it. So sorry about that. I cannot have any results to show you. But again, generally, it is also helpful in giving us an indicator Because all this, we do not want to say that we are diagnosing with all these devices. We can't, because they're only taking a few channels. But it's good enough to pick up with high accuracy that patients are at risk. And then we escalate it to our ENT doctors that we work with to then do more investigation. All right. So these are the two kind of testing device that we have. So literally, we see there's a big local population that is suffering from all this issue. 91%, they're not aware that they have this issue. All right. So the market is huge. And if we can implement in very good system, right, we can literally screen many of our patients that they are at risk, and then we can help them out. And of course, that will be also helpful for the revenue for our practice. Okay, so this is the local problem, right? 1 in 3 moderate to severe, more than 50% are having snoring mild to severe. And this will include children as well. So this problem is not restricted to adult only. I think most of you have already seen my video of the baby snoring, right? Can you see another screen? All right, maybe I have to stop share the previous one, sorry. Okay, how do I even stop? Oops, sorry. Help, stop sharing, okay. All right, let me change back to this screen. Is it the correct screen? All right, so how big is the global problem? So just now, Patrick also highlighted, 3% of GDP. So that is almost $600 billion for the top 5 OECD countries. And it's a huge, huge loss of GDP when everyone is not sleeping well. But because of political issues, no one wants to take responsibility for asking people to work overnight shift, among other things. So this is another discussion altogether. All right, next thing, are we qualified to manage sleep? Okay, so can you all write in the chat again, why are we qualified to manage sleep? Louisa, maybe you don't type first. Dr. Low also. I need to hear from the others. Okay. So why I ask this question is because I still have this very deep impression. I still remember once we passed by Hong Kong airport, right? Then Louisa went into, I think, a Gucci boutique to do something. Yeah. Then the staff came by to sell her a pair of shoes. And she didn't sell the shoe. She sell Gucci history. All right. She sell Gucci's craftsmanship. All right. So I just need to hear, like, why are we qualified to do it? Okay, so Melissa, okay. Okay. Martha Ming also highlighted, related to the mouth airway is unable behind it not to be ignored. Very good point. Right, Charlene say because the tongue position is the core factor to sleep apnea issue, and the tongue is part of the orofacial muscle. Okay, another good point. Can I have more? Because I'm not going to move on until I hear from the rest as well. Thank you very much. Eric, Jinping, Laura, Eric, Jinping, Isaac, Ashley, can you write something as well? Joel, Dr. Suzy, Berlin, Vanessa, San. Okay. Wendy say we have many successful cases. Really, in your opinion, why are we doing this, and how come we can do it? In your opinion, really, it doesn't have to be a right or wrong answer, right? I just need to hear an answer because I need to know whether you all know or not. No point I babble on and then the whole team, I cannot identify where the gaps are, right? So this whole point, this thing here, right, is to really identify the gaps, and I can really pick up those. I really need to sit down and I run another in-depth lecture for you. Right, we have the full picture of the oral structure, very good. All right, Patrick said, we understand malfunction, how it relates to airway and sleep. Good point, yeah. I think this is like tying up a few things that we highlighted earlier, that we know what is sleep, okay, because we are trained in Tufts University, like what Melissa has said, Dr. Low and I. And then we have a team of myofunctional therapists, educators, right, who are good at doing this. And then there are already research that says that, right, malfunction help with sleep. So Janelle says that mouth, nose, throat, all connected. Dentists are trained professionally to treat such condition. Yes, I think that's also a good point, that we're in the right time, right place, all right, for this to happen. It has not happened yet, okay? So we are going to make it happen. So this team, or all of us, we're going to make it happen. Because I think Jaya and if Minoli is not here, right? Yeah. And of course, the whole team that is also supporting them now, right? We're writing articles, we're creating websites, we're engaging people to help us publicize this more and more, so that they understand that we are actually doing this. Joel says, I'm guessing that sleep is quite linked to dentistry, and some dentists are further taking courses to practice sleep medicine. Okay, good point. And Wendy is saying that we are focusing on the root cause of health. Also, very good point, because I think that she is saying that we are addressing the sleep or breathing component of sleep. And Apple is saying that the space of the tongue will affect and relate to the teeth and the arch. Okay, yes, volume. So we're here to do volume and space management for our patient. Okay. So, yep, tough, train, very good. Which part of sleep are we treating? I think we mentioned it, structural and functional. All right. So the functional part is the oral myofunctional therapy that we are doing. We're very unique as a clinic. We have in-house myofunctional therapists, right? I think some clinics they do as well, but I don't think they have them as dedicated as ours, right? And I think from the very beginning, Martha started with this whole malfunction, and she has seen, I think, all our sleep patients, definitely, right? And now Charlene is also, doing more and more of this over the years, and we'll definitely identify a few more of you, right, that can eventually also be part of this team that can actually do myofunctional therapy, right, which is very important in helping with the functional. Then for the structural part, we are doing something that is helping the patient, right? Let's look at this part first. Okay, so what are our methods? Okay, the structural part. So functional part we know, right, is the myofunctional therapy. Then structural, what do we do to help in terms of the management of the space and volume that was highlighted? Yeah, by Apple. Right. So what do we do to increase the space and volume? Expand the arch, good. We're constantly looking to expand a team able to multifunctional and area interested. Okay, so Louisa just did an advertisement to recruit more multifunctional therapists. Okay, so yes, what Melissa mentioned something, expansion without extraction. Good point, two of you. What else? This is not the only thing we do for structural. What else do we do? Structural. Tongue tie release. Okay, I think it's structural that is very much related to functional. Very good point. Train the tongue, facial muscle to manage the airway. Good point, Hazel and Ian. Expand the arch. Yes, I think Apple can feel it herself. Right, her arch is getting wider and wider every day. All right, Charlene say focus on training the tongue and be in the up position. Right, so this is the myofunctional component that we do. Okay. What else? Yes, I think good point. A few of you. Okay, good one. All right. So Jaya mentioned that we do Sonomat and Prosonus, right? So they are the mandibular advancement devices. Okay. So you have all seen it, right? Jingping, you've seen it before? The Sonomat and Advent and the Prosonus Evo. Yes. Eric, yes, seen it? Both devices? Laura, I can see your eyes. Is it? Have you seen it also?
Hi, Dr. Yu. It's easier for us to speak. I think
good.
most of the DSAs, do we? Haven't really, I mean, me personally, I don't really know the devices. Don't know how they work and what's it all about.
Okay, good point. So this is thank you for highlighting that. That's why it's valuable that this is mentioned. All right, so that we will make it a point that we will share all this information properly to you. Okay, maybe since that is brought up, I still have a bit of time. Let's look at that one. Okay, let's go. So give me a moment. So basically, I shared with all of you on in the WhatsApp, right? And I think Dr. Wendy also highlighted that I was asking you all to watch that video, right? So that's the one that will give you a little bit of information, right? Please watch this before tomorrow's presentation. Do you all see this one? Yeah. Okay. So the link is there. Okay, just in case you missed it, just a moment. Let me do this. Share screen, share this. Okay, all can see the screen now. So, big issue. More than 1 million people, if you talk about 30% and undiagnosed.
When you sleep, your throat, tongue, and jaw all relax. This can narrow your throat's airway. Then when you breathe in, all the soft tissue around your throat vibrates, causing that awful snoring sound. But this could be a medical condition far worse than snoring. It could be obstructive sleep apnea, a condition that blocks the throat and literally stops you from breathing while you're asleep. When this happens, oxygen is cut off. The brain goes into a fight or flight mode and then wakes you up so that you can breathe again. I stopped breathing almost 30 times an hour. Sleep apnea can lead to high blood pressure, heart disease, heart attack, glaucoma, diabetes, cancer, and behavioral problems. Not to mention, you just don't sleep well. The most common fix for sleep apnea is something called a CPAP machine. It forces air down your throat, keeping the airway open. There's a problem though. You have to wear this every night. Not exactly the sexiest thing. Don't get me wrong, this works, and it works really well. But studies have shown that over time, people just stop using it. And I get that. I don't want to sleep every night with this mask on. So I tried something different. It's a custom molded plastic that fits right on my teeth, kind of like a retainer. When I wear it, it slides my lower jaw forward and then opens up my airway. To make it, my mouth was 3D scanned, and then molds were made of my teeth. It has these different levels that slide my jaw forward bit by bit. But the improvements have been remarkable. It used to be that I wanted to take a nap every afternoon, but now I wake up feeling rested and I can make it throughout the whole day just going. After a few weeks of using the mouthpiece, I took another home sleep test to see what the results really were. This chart shows all the snoring I had before the mouthpiece. All the different colors you're seeing are when I stopped breathing throughout the night. Now this chart over here shows a night with the mouthpiece. And as you can tell, it's working. Finally, I'm sleeping better, and so is the person next to me.
Okay. Anyway, you have access to the video anytime. You can look at it again. And in there actually is the Prosomnus Evo that we are using, right? So it looks something like this, 2 pieces. Hold on. Okay. So it has two pieces. So when you put together the top and the bottom, when the patient wears it, there's something to hold on to the mouth and the jaw, like that. Okay. So when they're sleeping, the jaw will not fall back. So 2 pieces. The other one, this is the Avant. Okay. So this one also 2 pieces, but it comes with a connecting polymer wire. So same thing, different position forward before patient gets to wear it. Okay, so we use TENS and K7. This is also very unique. All right, we're the only clinic, probably, or maybe Orchard Scots as well. I'm not quite sure, but they are not telling the whole world that they do sleep. But and I don't know that any one of them has gone through any tough training yet. Okay. So for us, we are in a good position. We have done proper training and we are able to utilize this kind of system. So we can screen the patient, many of them, identify the issues, and then help them with devices like this. So why?
I think, Dr. Lee, it might be good to also highlight the difference, right? I mean, like the typical sleep dentists, when they are trained, right, how do they take that position? Right, and then how you do it with, you and Dr. Loh, right? You all will do it with the TENS, right? So what is essentially the difference? I think it's worth highlighting, because that is also, so even though there can be other dentists out there who are doing sleep devices and can say that they are, it's just like how people are saying that they are doing Invisalign, but really the way that we approach is very different. Likewise for our sleep devices also.
Okay. I don't have the one that I want to demonstrate. Just a moment. I think that might be here.
Just like how our TMD our GNM orthotic, right? So when people say, oh, so that's the night guard, right, that most dentists are doing and issuing for grinding, right? But truth is that how I explain is that most dentists will just take the position as it is. You wear it, it protects the teeth, but you're still grinding down the jaw joints. It doesn't protect the jaw joints, right? And you're just wearing down the night guard, right? But when we incorporate this whole neuromuscular understanding and we take that neutral bite position, we are also placing the patient in that position, which is going to be protective for the jaw joints also. So this is already something that's very different, and not many people around the world knows how to do it also.
I don't have the one that with other dentists are using lah. Okay, so literally can imagine it's like a U-shaped fork. Okay, so it's like almost like this. I'll just show you. Okay, so let's say it looks something like this, like a fork. Okay, it is something like this shape one. Okay, you put inside the mouth, bite together. Okay, and you push your jaw forward like this, all the way to the front. Okay, maximum, push until 100%. Okay, when you get into 100%, they will mark out the spot and say, okay, this is as far as you can go. So to make the sleep device for you, I do it at 50% mark. So I bring the jaw back to 50%. So because your 100% is here, I bring back 50%, you'll be fine. Okay, but I think especially those who have seen me done TMD cases or take photos and for many patients, right? You see, sometimes the jaw is deviated, right, to the side or uneven, the bite, or they have already your joint problem. So you ask them to go 100%, the joint is like, the door is like out of position, not opening and closing well already. You got sound already, right? And you still push all the way, okay? And then you pull back 50%. So what will happen to this patient after wearing the device? Complain of pain, right? So this is exactly what we learned in school in Tufts University. Okay, you bite on the thing, you push all the way, come back 50%. Then after patient use it for a few months, you have to treat them for TMD. You double the income. That's what they are doing. That's what they're teaching even. So it doesn't make sense to me, right? Also, Dr. Low, right? Doesn't make sense, right? Then you know why? We know how to measure the position where the jaw is comfortable because we do the orthotic and TENS and K7 measurement. Okay, so that's what we do. We get the patient to sit and TENS and measure. So we get them, the door is not, we measure until the door is in the center already. And then we ask them to open and close. Now it's smooth, right? Okay, then we push to a forward position where the patient is comfortable. Patient tell us where they are comfortable. Their jaw float to the position. And then we take the bite. Okay, that is our starting point. All right, then from that starting point, we add 1 more mm, 2 more mm, 3 more mm. The patient is not feeling so uncomfortable, right? So this is what we do. And we are, again, like I say, probably the only clinic in Singapore, right, that is doing sleep appliances that is using this technique. Everyone else is just a simple out of position, push 100%, draw back, cause pain later on. Okay, so that is how unique we are. So if a patient asks, oh, what's the difference? You can tell them this. Really, we're really one of the trained sleep dentists who are using this method to do so, to measure you into your comfort position before making the device. We are the only one in the whole Singapore. That is how different we are. Okay?
And in fact, we are also channel partners for the device, right, in the Asian region, for Myotronics.
So we are the distributor to help with the measurement, the Myotronics. We are also the distributor for ProSomnus Evo, right? So if more dentists in Singapore uses Evo, our health company, Dental Helvers, DP Helvers, right, is also making a profit out of this. But like I say, today I sound a little bit more commercial, but I just want to, just trust me that I am ethical and do my best for my patient. All right, that's me. But I need to bring forth the commercial sense to all of you as well. That's why I have to give that little bit more information on that. Okay, even the Belun testing device and the night owl, I'm not sure about night owl anymore, but is Joel HI still holding the distribution? Not sure, sorry.
Yes, we are actually.
Yes, okay, so night owl and Belun, we are all working towards getting the distributorship for Singapore as well. All right. So what we are also trying to do is, because since we are the first one there, nobody
Not just Singapore, but Asia.
Okay, thank you very much. So we want world dominance starting from Asia. All right. So basically, what we're trying to do is that we want to provide the whole system to do things properly. So that's why we go and do our training at Tufts University. Okay, why Tufts University? Because they are the accrediting university in US. All right, that is providing this kind of training for dentists in US. All the top researcher, lecturer, practitioner in this sleep field come, not only just dental, but also the ENTs, the myologists, pulmonologists, yeah, all this from the medical and dental side, they all go to Tufts, they teach the program, right? And from there, we learn to get self-accredited. I myself even went 2 rounds, all right, two mini residency with them. Okay, so we learn the thing properly, then we come back, we see there's a big problem in our local context that need help, but not many people know that they have this issue. So we're also depending on our marketing, right, all the things that we do. But just nice, right, to do this sleep part, all the things that we've been doing, myofunction since 2015, right? Martha has been doing all the practices with all the little children until the adults.
the password for these laptops, yeah.
Yeah. So because of this, right,
Yeah.
she's very prepared, right, to deal with all this TMD patient and also sleep patient as they come along from Martha. And then we're also developing program to, like say, further consolidate this position. Then, in order to do this properly, I say we need the equipment. So that's where we're sourcing the best equipment in terms of the advance is the thinnest. And then later we found ProSonus Evo even thinner especially for our ladies patient. Because I still remember one of my lady patient when she's using this, they say this part here is always at the lip and she cannot close her mouth. Very uncomfortable. So when we make the other one, into is at the side, she can for ladies it's easier to close her mouth because it's even smaller. All right. So we create the ecosystem, right? And then for patient, wearing this cannot be a whole lifetime of issue, right? They cannot just depend on this whole life, right? So of course, some already 50s, 60s, they don't want to do any orthodontics. Then okay, no choice. And some of them really just want to wear this. They don't want to move their teeth. Don't want to do more. Okay, so good. But even then, some user of this, if they just use this alone, right, they can still snore and they still have apnea. We call this a non-responder. That means when we learn in school, in Tufts, say that you give them this device, they cannot heal. Why? You all mentioned it in the chat already, because the tongue is not in the right position. It's not in the roof position. So it still blocks the airway. Okay. So by adding the myofunction component, we solve the other half. That's why just now I mentioned about, we solve the structural with device, functional with the myofunction, right? Then we combine both together, we get closer to the full healing, right? And we are very unique in that. Again, we have very dedicated myofunctional therapists, right? And now even ENTs recognize that we can do this. They are also collaborating, and some of them occasionally send a few cases to us also to help with the myofunction part. And online, some parents are also finding out that, hey, their children are snoring, they can come to us and we can do the myofunction part for them. And then in some children, some adults, before we show them this kind of devices, right, we can already start doing the Invisalign for them with the end in mind. The end in mind is we don't make their jaw or whole mouth or the whole volume in their whole jaw and cranium area smaller. We don't want to lose the volume. So that's why we do our special way of management, right? Our method is right? Simply non-extraction, right? So we do myofunctional therapy, non-extraction Invisalign. We do orthotic as well, right? And mandibular advancement device. So in some cases, even the orthotic alone, which is not both sides, right? The orthotic is only one side, just this, right? Just one side, just a single device on the lower jaw also help, right? With especially with the myofunction, right? Already some of them, even before they take the device, sometimes they just go and see Martha and do the exercises, already help. You know, they already get better just because they start changing their habits. That's how we put all this together. Okay.
So just want to highlight that this component of adding myofunctional in therapy into sleep management, right, is also something that is unique in our practice. So it's not taught in the TERFs course, and it's not commonly done also.
Yeah,
And
we are very, yeah, thanks for highlighting that. So we're very advanced in this. Yeah, in Tufts University, even though it's an accrediting center, they don't teach this like a full curriculum. They still already invite some of these myofunctional therapists to discuss it, especially in the pediatric obstructive sleep apnea courses, which I've not attended yet. Okay, but for us, by moving myofunction into this field, we are very early and we are very unique and we are very powerful in this, because we have very, experienced myofunctional therapists in Martha doing all this, and also later on she's sharing all this with all of us, right? So this component, Dr. Kelvin Chai, okay, you will hear about him. He's a dentist, also trained in sleep medicine. He didn't go to Tufts University. He went to the Academy of dental sleep medicine, I think, to train. Okay, so for him, it's very structural only. Yeah, so he does sleep devices, but no myofunction. And he himself is not trained in orthodontics. We discussed this before, so he's not doing the ortho part for the patient as well. So in a sense,
Dr. Can you also just highlight, right, when is it that patients are doing, I mean, it's same, right, to help with sleep issues, but some patients end up with the Somnomet or prosomnus. Some patients end up doing Invisalign with extraction and myofunctional. So how is that? When is it?
I think that the most ideal is treat it early, right? Young children, they already say, if you do myofunctional therapy, change your habit, the jaw will grow, your breathing pattern will change. You will be at least, right, 43% to 62% improvement in your all this AHI or blockage index already. Okay, so more than half the better one for children if they just change habit. And we shouldn't lock them in devices anyway, they're growing, right? So we help them to grow. And then when they need to do braces, Invisalign, because they got great teeth, because that is already the sign, all right? So this is also the point that I want to make a little bit earlier, right? How we tell that they are at risk. So they're mouth breathers, they're crooked, they have TMD, and we can screen them. So these are the people that we can pick up early, right? And some of them, yes, we can do the Invisalign and myofunction for them, so that we can help them to avoid this situation of wearing the sleep devices. And then come the other group where they are already diagnosed, or they're not sure, right? And they don't want to do braces or aligners, right? They just want to wear something. Then yeah, so this kind of devices is actually helping them to a certain extent. Some already use the CPAP machine, that whole mask, and they don't want it because they cannot tolerate it. They cannot wear this every night. So they come to us and ask for a device, and then yeah, we can give this device. And we also, or we should I say, we used to work with the ENT doctor, Dr. Han. Before he does the surgery for the patient, he will refer them to us to make one device also. So there are many combinations like this. So ideally, train first, malfunction, change habit. If need to, expand the jaw, non-extraction. If they don't want to do that, then a device will come in. And some of them, because they have TMD, we treat with the orthotic, they already improved. Some still not. Then we also have cases where we make the orthotic and also we make the sleep device for them for both day and night, different devices. We have that as well as a combination. Okay. Right. So I think just last part. This is a method. What are charges? Right, myofunctional. We will provide 2 modules, 750, non-extraction, orthotic, mandibular advancement device. So who else? ENT, SGH, Sengkang Hospital, and few dentists. So why I highlight Sengkang Hospital is that they are quite forward thinking. They are the first one to also do sleep device, CPAP, and myofunctional therapy. And they also provide a pamphlet for the patient to actually look into that. And they actually do some videos as well. All right, Sengkang Hospital. SGH, they're not that strong in the myofunctional therapy part. All right, so to my understanding, yeah, they are the one. All right, ENTs, usually they are very particular, should I say they're very straightforward, go and do the surgery for a patient. It's claimable by MediSafe and insurance. That's why some patients choose surgery instead. Okay, so I think just to sum it up, this is the offering, right? We look at it this way, but I think it's good that we will provide a little bit more in-depth for the DSA who is not assisting on this, even the PRE, sorry, should I say, or anyone, should I say, go run. That one is just a very standard, okay, course on it for all of you. Okay, thank you. Hazel actually highlighted, patient is here. I think everybody is ready. Right, it's 10 o'clock, just nice. And I thank you for your attention. Thank you.
I think those who have to go, please go. But I'm actually keen to hear, some feedback on, how useful you all found this session, and also, the kind of format, right? I really enjoyed it. I think it's when Dr. when you ask questions and then when we elicit response, it's definitely a lot more it's clearer, because we know where are the missing gaps also. Yeah. So yeah. So those of you who have to go and see patients, please go ahead. But those who can still stay back, I would really like to hear some feedback. And then also what are potentially some of the other topics that we should be covering, or maybe should we even go further deeper into sleep, because this is really just an overview. Yeah.
But I thank everyone for responding. Yeah, I thank everyone for engaging and writing in the answers and giving me your attention for the day. Yeah, thank you. Thank you very much. See you all. Bye bye. I go to see patient now.
Yeah. So thank you, Dr. Yu. Yeah. So anyone would like to give some feedback on regarding the format, or regarding what further topics, right, you'd like to learn more? Would you like to go deeper into sleep, or is there any other areas also, or perhaps someone
maybe can export the chat as well. Thank you. Bye bye.
Okay, Dr. Wendy says maybe deeper into how the devices work. What else?
So for example, like what is the difference between the orthotic and a sleep device? Like in terms of the device, what does it do? Like deeper into that, so understanding. And also the difference between, say, the Belun ring and the night owl. Like what are they detecting?
So really showing the reports, right, and seeing, yeah. I mean, currently the orthotic is being used for TMD patients, and it's only on the lower. Yeah. Sorry, I'm blocking somebody. Yeah. Any other comments from Dr. Susie? Are you feeling better? Thanks for logging in. Well, still not fully recovered. Anything with it? All those of you who are actually on leave, and yet you're logging in. Any other form of feedback? What other topics do you want to, what's our next scheduled topic, Dr. Wendy? Yeah. Or maybe we should get Dr. Yu to do another session, but deeper, like you say, right? By then we can probably see the the night owl report and compare it to the Belun report. And then noted on how the devices work. Maybe you can let Dr. Yu know about that, right? To cover that. Actually, Dr. Low will be able to share also. What else? What other topics? Hongmei, what other topics would you like to learn more of? Perhaps after that, actually, would be a good thing to get Martha to share more about myofunctional again with the new, especially the new team members, right? And then maybe even carry out the exercises, because I think if you notice, right, myofunctional is the underlying thread, right, across all, for TMD, for sleep patients, it's the first line for kids, right? So actually, I think it's time to revisit the whole understanding of myofunctional, so that, and it's also it should be a daily practice by the team also, that we need to practice it too. The way I see it, it's like doing yoga for the tongue, right? Actually, it's something that, if you have some issues, then it will help with the issues. If you don't have any issues, well, it's just maintaining muscle tone, right? And that is only good because we know about degeneration as we age, right? So yeah. Anything else?
Maybe I think it'd be interesting to find out what a health coach does, because I think some of us won't know. Like in a health coach consult, like what do you talk about? What does a health coach do?
And actually, moving forward, we also want to offer this service to the team. I think we should, you're all likewise, right? Like I say, please book your sessions for therapy with Shu Fei and come and use the red light Novathor at Katong on your off days. I think it's important that we know and experience. And in fact, I should ask the Shu Fei and Mahez to also come and experience our dental services. And then we can really do that whole cross referral component also. That's very important. Yeah. Yeah, good point. Martha and I are still kind of finalizing the how we're gonna carry it out. But at some point, yes, we will definitely want to share about what a health coach does. Yeah. But the interesting thing I say also is that, just to update everyone here, it's like when we do, and Charlene is currently undergoing the course, actually what we are undergoing is a functional medicine health coach course. So it's coaches to support functional medicine doctors, all right, who incidentally focus currently mainly in nutrition. But of course, they will talk a little bit about sleep and movement, but they but when it comes to breathing, they mention meditation, so actually their understanding is quite not as deep as ours. So in fact, I'm currently talking to Martha, to Dr. Wendy. We are actually even looking at crafting a functional dentistry for health coaches course, right? That we can in turn teach our health coach alumni. Yeah, because there are certain gaps, because lay people right now, they know meditation works, but we know it's because of breathing. Another thing is I'll share later to the big group. I've reached out to clinicians, but so far only Dr. Yi responded. But basically, Martha and I are currently undergoing an integrated breathing therapy course so that we can really, because so far, whatever we've been exposed to is just the take-home method. But there's actually a lot more other methods, and even in pranayama, breathing and all that, right? There's a lot more that we can be learning about breathing and breathing therapy. All right, so that's the area, that we are, another rabbit hole that we are going down. But happy to set up a study group so that we can share our resources. And sorry, the car in front of me is backing up. So we can share our resources, and so that we can learn together, right? So for those of you who are interested, I'll add you all to a WhatsApp group and share some PDFs of the lecture notes and all that. And if you can read it and you still have questions, right, Martha and I can be the representative to ask during our Zoom tutorial sessions. So it's a course conducted by Roselva Courtney. She's an osteopath, but she went on and did a PhD in breathing sciences. Yeah. So just to share with you all, this is like really the where we're headed. And I think to add on to what Dr. Yi mentioned earlier, right? I think we don't do things in half measures. I always say, we bought the laser. We didn't just use it on patients. Okay, Dr. Yi went on and became a laser trainer, and he's even invited to different universities in Indonesia to teach in the universities to the specialists who's never been taught lasers before. So even Invisalign, right? We don't just stop there. He's presented to the CEO before he's now a trainer, in Invisalign. So likewise, also, Progressive Practice is our channel partnership company, right? We are representing Munchie. We are channel partners for Munchie, for Myotronics, Night Owl. Now we're talking to Belun. We're talking to Myosports. And so we become like the gateway to all things that's related to all these P's, right? And whatever equipment or tools you need, right? We are going to be the channel partners to redistribute this to Asia. And then of course now we have our academy, right? Again, so really just to share with all of you, right? We don't just set our sights in just within our practice itself, and not even just within Singapore itself, right? But whatever we do, right? Actually, we position ourselves as the gateway for Asia. Yeah. So that you all have a better idea of the whole vastness and how big this vision is that we have. Yeah. Okay. Thank you all for your time today, and have a good day ahead. I think Janelle, I'll text to the group later on. So over the next few days, we'll be scheduling conversations with everyone regarding the salary restructuring part. Okay. So thanks everyone for staying on, and have a good day ahead.
Thank you.
Melissa, please save the chat and send it to Dr. Yi. Thanks.
Yeah, okay, no problem. Mr. Shi, just
Yes,
a suggestion. I was thinking maybe for everyone's clearer understanding, right? We can show how a typical dentist does bite taking for a night guard, and how we actually do it differently to take the bite for the orthotic. it really makes a difference. So I think it can give
Typical dentist
a
is
clearer idea.
put the impression in and take the bite
Yeah,
as it is.
用完啦, not useful, the night guard.
Yeah.
Yeah,
I mean,
so
yeah,
maybe
I think we
for
really need to
everyone's clearer
highlight the difference.
understanding. Yeah.
Yeah. Then for us, it's the whole TENS procedure and the
Yes.
yeah. Actually, Dr. Yi hasn't shown the whole procedure, right?
Yeah, so far not
Yeah,
yet.
maybe he should. Yeah, maybe the next time is really have to go a bit deeper into the even the every step of the procedure kind of thing, right? How we take a bite, right? So that at least everyone has an idea of how complex it is. Yeah. And that's the one
Yeah,
where
I'll mention that.
yeah. So maybe a little bit more deep dive so that they can see a start to finish kind of a thing, maybe through photos or if you have videos, or a live demo. I don't know how we can do a demo with a camera on while we record it. I don't know. We'll see how it goes. Okay.
Yep.
Okay. Great suggestion. Thanks.
Thank you.
Okay. Thanks. Thanks for hopping in, Jaya. Okay, bye everyone.
Bye bye.